Hi, welcome to the Compassion and Therapy Summit. I'm Lorraine Hobbs, and I'll be your host for this session. I'm the founding director of the Youth and Family Programs at UC San Diego Center for Mindfulness. I'm also co-founder of the Mindful Self-Compassion for Teens program, which was adapted from MSc. I'm happy to be here with Dr. Kristin Neff to explore the science of self-compassion. Dr. Neff is one of the pioneering leaders in the growing field of self-compassion and self-compassion research. She's an associate professor of educational psychology at the University of Texas at Austin and has co-developed the Mindful Self-Compassion Training Program as well as the Self-Compassion in Psychotherapy program. She's the author of several books, including her most recent title, Fierce Self-Compassion: How Women Can Harness Kindness to Speak Up, Claim Their Power, and Thrive. Thank you for being with us, Kristin.
Oh, thanks, Lorraine. Happy to be here.
So to begin, why don't you just tell us a little bit about what self-compassion is and why it's so important to those working in the helping professions?
Yeah, so compassion, self-compassion is simply compassion turned inward. Normally, when we think of compassion, we think of helping others, being concerned with the alleviation of suffering, care. But the idea is that we need to turn that lens of compassion inward as much as outward. So an easy way to think about it is treating yourself with the same kindness, warmth, support, encouragement that you would naturally show to a good friend you cared about.
So I understand, Kristin, that there are three components or different elements of self-compassion. Can you talk a little bit about that?
Yeah. So it's actually more than just kindness alone. The first thing we need to have in order to feel compassion, either for others or ourselves, is actually mindfulness. So mindfulness refers to the ability to be with what is. And in order to have compassion for ourselves, we need to be with our own pain, right? And normally we want to be anywhere but with our own pain. We want to ignore it or we want to fight it, but we have to be willing to open to the fact that we're hurting in order to give ourselves compassion, right? And then hopefully when we open to the fact that we're hurting, we can treat ourselves with kindness and warmth as opposed to maybe harsh self-judgment. But there's a third component that's really essential that makes it compassion, and that also makes it slightly different than pity. What's the difference between compassion and pity? A sense of connectedness, right? So in order for it to count as self-compassion, it's not like poor me, woe is me. We need to remember that, well, everyone is imperfect and everyone struggles in life. So it's not like we're feeling sorry for ourselves. So self-compassion, even though the word self is there, is actually not self-focused. What we're doing is we're framing our own imperfection and our own struggles in light of the shared human experience. And that's one of the reasons it provides such strength.
Thank you, Kristin. So let's talk a little bit about how this would work in psychotherapy. Often we hold our clients' difficulty and their trauma in our hands, and we can really feel the sorrow of being with people when they're at their most vulnerable. And of course, the experience can be painful if we come up short or we create a rupture in the relationship. So the difficulties of the past 2 years have made these experiences much more intense. How can self-compassion help?
Yeah. Thank you for that. It's so true. I mean, also, a really good therapist typically is very empathic. That's part of the reason people go into therapy. And so what that means is when you're working with someone who's in a lot of distress and you're resonating with their distress and you're a good therapist, and especially not only are you resonating with the distress of your client, but also your own, because, the pandemic is happening to you and maybe your kids watching Zoom and going to school in the other room, and so much is happening.
Mm-hmm.
So self-compassion is, from my point of view, absolutely essential for anyone who's caring for another, whether you're a professional caregiver like a therapist or a nurse or a doctor, or even just in your personal life, helping your kids or caring for your elderly parents. And let me explain kind of how it works, if you don't mind. So what we know about the human brain is the human brain evolved for empathic resonance, right? So we develop mirror neurons and other parts of the brain that are just designed to feel what other people are feeling. And again, like I say, some people are even better at that than others. Really empathic people are really sensitive to the emotions of others. And so what happens when you resonate with the suffering of another is the pain centers of your brain are being activated. You're really feeling it. Again, on top of all your own suffering, just to make things even better, right? So if you just turn compassion outward, in other words, deal with the pain of the person you're working with, if you're just focused on having compassion for them, but you don't attend to your own empathic pain, or maybe the other struggles you're going through in your life that are making it difficult, what will happen is your cup will run dry. You will burn out. Compassion is not a limited sum. It's not like I've got 5 units of compassion, and if I give 2 to myself, I'm only going to have 3 left over for you, right? It's additive. So in order to be able to have the resources necessary to be with others, in therapy or any other context, to really be there for others, I need to make sure I'm resourced by having compassion. And remember, that means being mindful of, being aware of my own empathic pain or my own distress, my own overwhelm. Remembering I'm not alone, this is just part of being a human being. Okay, it's hard to be a caregiver. It's hard to be a parent. It's hard to live a life, hard to go through a pandemic, whatever it is. And then really importantly, giving yourself warmth, encouragement, support, and kindness. And so when we do that, and the research shows this, it actually helps us to sustain giving to others without burning out. And there's a kicker. Excuse me for going on, but this is the cool thing about how this works. Empathic resonance goes both ways. So, if you're my client and I'm feeling your pain and I'm giving myself compassion because I'm feeling your pain, well, you as my client are also feeling my compassion with your mirror neurons. So if I'm burnt out and stressed and frustrated, you're kind of subtly picking up on that through your mirror neurons. But what I embody as a therapist or as a parent or as a caregiver is actually felt by whoever it is I'm caring for. And so, compassion, it really is bi-directional. Our own emotions affect those of others, just as others' emotions affect those of ourselves. And so one of the most effective ways to deal with the distress of being a caregiver is to give ourselves compassion. And that helps not only us, but the person we're caring for.
So basically, staying embodied, like in the psychotherapy room or in whatever capacity you're working with people, staying embodied kind of helps you recognize whether or not you're in empathic distress. And then having the skills to address your own pain will help you stay present in that loving, connected presence with your client. Is that what you're saying?
Yes, exactly. So, embodiment is probably the easiest way to stay connected with your own pain and the pain of your client. But also you can use phrases, you can say something like, to your client, may you be well, may you be strong, and maybe to yourself, kind of giving yourself this, saying, this is really hard, and I'm here for myself. You can also use, for instance, the breath. We teach a practice, which I'm going to teach later, where you use the breath as a vehicle for giving yourself and others compassion. But you're right to point to the body, because the body is always here and now. Our minds are often anywhere but here and now, right? But the body is always here and now. So by grounding ourselves, maybe feeling your feet on the floor or just feeling the weight of your body on the chair, it's an important way to maintain presence. Mm-hmm. And another way you can embody self-compassion, and you can do this very subtly, is by using compassionate touch. Now, when you're alone or when you go to the bathroom, you may want to do something like, kind of put your hands on your heart. But obviously you don't want to do that in front of your client. But just simply, I don't know if you can say folding your arms or maybe holding your own hand, some subtle gesture. If you're doing it with the intent to physically give yourself some caring touch, what it actually does is it works on the level of physiology. We know it reduces cortisol, it increases heart rate variability. So it's not just being present in your body. If you can, also using some sort of subtle touch to remind yourself of your own physical presence and support. That's another way you can give yourself compassion in the moment.
You're really talking about how we cultivate resilience through self-compassion. Is there anything else you can say about the capacity of self-compassion to really help us connect with others, relate compassionately, build that inner resource of resilience?
Yes, absolutely. Self-compassion is an incredibly powerful source of coping and resilience. And it's funny because a lot of people think that compassion is weak. It's soft. They kind of look down on it. They think that somehow harsh self-criticism is being tough. It's the exact opposite. You can think of it as when you go into battle, who's going to make you stronger? If the voice inside your head is an enemy, shaming you, cutting you down, is that really going to help? Or if the voice inside your head is an ally and says, I got your back, I'm here for you. And so what we know from the research is because compassion is a way of relating to suffering, relating to suffering with mindfulness, with some space, with the sense of connectedness, and with some kindness, with love, if we can use that word. By relating to suffering with the resource of compassion, it means the suffering isn't so overwhelming. And that basically is the definition of resilience. And so this is the same for us as if we're a caregiver, a parent, or a therapist, but also for anyone we're dealing with a difficult situation. So just to give some examples from the research, well, I know a really dramatic example is combat veterans. Right? Combat veterans who are pretty tough, right? What we found in the research, and there's a lot of studies on this, combat veterans who are more compassionate about the trauma they saw in terms, overseas in combat, they're less likely to contemplate suicide. They're less likely to turn to drugs and alcohol as a way to deal with their trauma. They're less likely to, they're better able to function in daily life, and they're less likely to develop post-traumatic stress syndrome. And what they also found in one cool study, they found that self-compassion had a bigger effect on whether or not a soldier developed PTSD than how much action they saw overseas. And the reason I like this is it illustrates it's not as much what happens to you, but how are you relating to what happens to you? When you have something very difficult happen to you, what determines whether or not you become overwhelmed by it? What determines whether or not you're going to be resilient? You're going to be able to cope? You're going to be able to get through? A big factor in determining that is, do you shame yourself? Do you judge yourself? Do you give yourself the cold shoulder? Or are you compassionate? Are you understanding? Are you patient? Are you encouraging? Right? And we know from the research, there's a lot of research now on this, that self-compassion makes you stronger and more resilient.
I have a specific question. I mean, what I liked about what you said, and the implication is that if people, excuse me, aren't going into PTSD as readily, and they use self-compassion to care for themselves, then that implies that their re-entry into their families is going to go well too, right? I mean,
yeah. So again, the one study looked at daily functioning, and I think it did have some sort of assessment of reintegration into family life, and it did help. So and self-compassion. I mean, and this we have similar findings with parents of special needs kids, people coping with cancer. I mean, basically any difficult problem, the more you're able to support yourself as you deal with that problem, the more resilient you're going to be.
So I have a specific question around resistance to self-compassion, and people who might be experiencing some fears of compassion and self-compassion. What would you suggest to clinicians, in addition to caring for themselves, about how to ease clients into this work with self-compassion?
Yeah, thanks for asking that. So Paul Gilbert has done some of the best work on this idea, and especially because he developed a form of self-compassion therapy specifically designed to help with clients who are resistant to the idea of self-compassion. So there's a lot of reasons why people are resistant. Sometimes if you had an early family trauma, or you were made to feel by your parents that you weren't worthy of care and you weren't treated as with respect, then it can feel really unnatural. Sometimes people feel they aren't worthy of a self-compassionate response, right? They've got insecure attachment. Sometimes it's actually not just early family history, it's just the culture. So again, our culture tells us that self-compassion is weak, that it's selfish, that it's going to make us self-indulgent, that we're going to make us lose our edge. And so we know all these are blocks to self-compassion. And so the way you deal with blocks of self-compassion partly depends on what type of block it is, right? So obviously a therapist dealing with someone with, or maybe who was abused as a child, is going to be different than someone who's just maybe raised with the ethic of you got to drive yourself hard and achieve your goals and like make a lot of money. So every clinician will have to use their own intelligence and wisdom in terms of how to approach these barriers. And also, I also have to say, just full disclosure, I'm not a clinician. Chris Germer, my colleague, calls me an honorary clinician because I know so many clinicians, but I'm actually not a therapist. But so from what I know from talking to people, and I teach a lot of workshops, is first of all, you can't argue someone into self-compassion, right? You can't force it on them. If you try to force it on them, it may actually backfire on you. They may just have a really angry reaction, or they may just shut you out even more. No, I'm not worthy of it, just like kind of shut down. So what you can do, what I find, at least if I'm teaching a workshop and someone's very resistant, is I actually start where they are. So I help them get in touch with some of the pain that they're in the moment. Like, well, how does it feel that you feel you aren't worthy of compassion? Ouch. So instead of like being in their head, they can deal with the particular thing they're dealing with in the moment. Like, yeah, it's really sad that I don't feel I'm worthy of compassion. Or yeah, it's kind of, yeah, I've lived my whole life driving myself hard with self-criticism. Ouch. So you kind of start with the pain of where they are and help them in the moment. Just be a little kinder to that. Can you just acknowledge that maybe that's hard? And also remember that you aren't the only one. There are lots of people who feel just like you do. So you kind of help them in the moment be compassionate toward the block they're feeling. And sometimes that's a way through. Other people, like for instance, when I talk to surgeons who are notoriously resistant to self-compassion, the science tends to go a long way because there's so much research on this. If people are resistant because they think it's woo-woo, you can go to my website, selfcompassion.org, and I've got thousands of studies now on self-compassion. That can help. Another thing that often helps is if you use an example they connect with, like, well, what do you think would happen if you treated the way you treat yourself, if you did that to your child or your good friend, something that they're less blocked to. And then usually people say, oh, actually, I would never do that. That would have a horrible effect. Well, then what effect is it having on you? So those are just some of the ways you can find your way in. But again, I do think every therapist has to use their own wisdom, and it depends on the particular client and their situation.
Thank you, Kristin. It reminds me of a time when I was working with a group of teens and teaching them the Making Friends with Yourself, which is now Mindful Self-Compassion for Teens. And we were doing the soothing touch, and this one teen really could not engage in even the soothing touch at any level. And finally, she came up with the idea of just touching her fingertips like this. And it worked for her. And as the course progressed, she was able to get to some of the other soothing gestures. So I really like the idea of meeting your client where they are and not trying to push them through that self-compassion door. So
yes.
that's, yeah.
And I also like what you're saying there, Lorraine, because it also means starting small, which is another thing, taking baby steps, just kind of putting your toe in the water.
Yeah,
Start
absolutely.
to reduce some of that resistance, and then it comes at its own time. And we have a saying in the mindful self-compassion world, which I'm sure you've heard, walk slowly, go farther. So just a little bit at a time, as long as you're moving in that direction, it helps.
Yeah, thank you. So I want to acknowledge your new book. I finished reading it and I'm reading it again, and there is so much beautiful information in that book. And I'm wondering if you can just share a little bit more about tender and fierce compassion with us.
Yeah, so my new book is called Fierce Self-Compassion. And in that book, I really kind of highlight the different sides of self-compassion. There's a tender side and a fierce side. And most people, when they think of self-compassion, really only think of the tender side. And self-compassion can be very tender. You might say the tender side of self-compassion is all about acceptance, about accepting ourselves as imperfect human beings, about accepting the fact that we're hurting. It's a soft, warm, nurturing energy, kind of like you might say a mother or a father holding their newborn child. I mean, that child can be screaming its head off, but you rock that child and soothe that child, and eventually the child starts to calm down. And that's a very important aspect of self-compassion. It tends to be soft and gentle. But it's not the only side of self-compassion, because again, if you define compassion as concern with the alleviation of suffering, there's also another side of that, which I like to call mama bear self-compassion. So, if you're a parent and someone threatens your children in any way, you aren't soft and gentle and soothing. You can be ferocious and fierce. So the energy of protection, saying no, drawing boundaries, saying stop, you cannot hurt me. That's a really important part of taking care of yourself, helping yourself. Also providing for your own needs, right? In other words, you aren't just like passive if you say, I really want to go to college because I never graduated college. It means so much to me. Oh, that's not really self-compassionate if you're complacent. What's self-compassionate is like, go to college, start going to night school, whatever it is, identifying what your needs are and taking action to meet those needs. And then finally motivating change, right? So we can accept ourselves as we are. We're intrinsically worthy because we're human beings, but doesn't mean we want to accept all our behaviors, right? If I'm engaging in a behavior that's harming myself or others, it's not compassionate just to let that behavior slide. Or if I'm in a situation that's harmful, maybe I'm being treated unfairly, or there's discrimination going on, or someone's sexually harassing me. It's not compassionate to accept the situation. So at the same time that we need tender acceptance of ourselves, in order to be self-compassionate, we also need to take action to change situations or to meet needs or to protect ourselves in a way that helps us be well. And so the reason I wrote the book is because, again, this really a block for a lot of people, that they don't realize there's this fierce side of self-compassion, so that kind of puts them off of it. And it's, again, the research shows without a doubt, it's about acceptance, but also about change. But I wrote it specifically for women because, unfortunately, women have a lot of socialization blocks to fierceness. And I like to call it yin and yang instead of masculine and feminine, because in fact, the fierce energy is more of this yang energy, which is a kind of a powerful action energy. The yin energy is more of a soft, gentle energy. In Chinese philosophy, they define ill health as an imbalance between yin and yang. And yet, if you look at gender role socialization, and this is pretty much worldwide, built into the system is an imbalance between yin and yang. Men aren't allowed to be soft and tender. That means they don't have access to the healing power of self-acceptance often. Women are socialized not to be fierce, not to have too much yang energy. Women are called the B word, if they're too fierce. They aren't allowed to get angry, even sometimes when the anger is necessary to protect themselves. And when everyone needs both fierce and tender self-compassion. So when I was first writing the book, I thought, well, I could write it for everyone, but then it was too convoluted to say, well, the block for men is this way and the block for women is that way. So I wrote it just for women, but I've had a lot of my male friends say they read the book and got a lot out of it too, because really everyone needs to balance these two energies.
Well, when I was reading the book, it really brought a very important question to mind for me, since you know that my specialty is working with teens and kids and parents.
Yes.
Adolescence is a time of belonging. And in fierce compassion, you're talking about standing up for yourself and drawing a line. How do these two work together for adolescent girls? How do we begin to give young women and girls exposure to having a voice equal to men? And what is the risk?
Yes. So, well, it's really interesting, this idea of being a people pleaser. And even though gender roles, women have made some progress, we still aren't equal, but we've made some progress. But gender roles haven't really changed much, sadly. I mean, a little bit, but not much. And so the reason self-compassion is so important for everyone, but especially for women who are taught that they need to go along with others or not to speak up or to belong, people need to like them. And the way they get people to like them is by saying yes to everything and going along with them, is we need to give them an intrinsic source of self-worth. Right. So one of the things that self-compassion does for you is it gives you an intrinsic source of self-esteem and self-worth. You don't need to feel good about yourself because other people like you, or because you look a certain way, or because you get certain grades. Your worth is intrinsic. And then you want to get good grades, or maybe look a certain way, or have friends because you care about yourself, not because your self-worth depends on it. So it's a really different motivation for engaging in life. And so the more that teens are able to have that intrinsic sense of worth that comes from self-compassion, the less dependent they are on the approval of other people to get that source of self-worth. right? So, and in terms of the dangers of it, so as with everything, we need balance, right? And so the danger can come is it when we aren't balanced. So too much yin without enough yang, or too much tenderness without enough fierceness. And you might say that historically, women weren't put in that position because they weren't allowed to be fierce. It can lead to complacency, right? So when women weren't empowered to speak up, and it's not just gender role socialization. A lot of it is like real sanctions of the patriarchy are powerful against you if you do speak up. So it's not just inside, it's also outside. But when women aren't allowed to express themselves, then that leads to maybe complacency or subordination, or the lack of being able to achieve your goals. But if you have too much fierceness without enough tenderness, that can morph into aggression, right? So for instance, anger is useful when it's aimed at alleviating suffering, preventing harm. But when anger starts causing harm, because you're making it personal, you're calling someone else names, you're making them feel badly, then it's actually no longer in the service of compassion. And that's why we need kind of the tenderness and fierceness integrated. So it's something that you always have to be on the lookout for. Am I balanced? Am I balanced in this moment, or am I out of balance? And by the way, it's not like we develop this state of perfectly balanced self-compassion and we're there forever. I wish that were the case after 25 years of practice, but it's not. We're always getting it wrong. Self-compassion is really a process of how do we relate to getting it wrong. And when we relate with compassion and with both fierceness and tenderness, it helps us get recentered.
Right. As you explain in the book, it's the idea that we're not going to move into, we can call it the threat defense system, as a way of protecting ourselves or standing up for ourselves. We have to stay connected to compassion, but compassion for ourselves, and recognizing our own worthiness, that we too deserve, access and power and agency.
Yes. And by the way,
Yeah.
I'm not going to pretend that it's easy. It's a very messy process. I am certainly not an anger expert. In fact, one of the reasons I wrote the book is my own struggles with anger. I'm kind of by nature more yang than yin, and reactive anger. If you met my mother, I come by it honestly. It's just the way we're wired. And so a big journey for me was not that we shouldn't try to deal with reactive anger. Of course we should. And of course we don't want to hurt anyone and all those things. But we don't want to shame ourselves for it either, because that angry energy, which actually does come from that sense of defending ourselves or protecting ourselves, is tied to so many good things. So we want to be able to harness it for good, as opposed to rejecting it, or even as opposed to, mindfulness does help. Mindfulness really helps us not be so reactive. But sometimes I found, even in the mindfulness world, there's not only should we make space for anger, we also need to get down on our knees and say, thank you, anger. Thank you for your power and your energy and your focus, and for trying to help me. So it's not a neutral relationship, I think, that we should have with anger. We should really be grateful for anger, at the same time that we need mindfulness to try to prevent us from harming others with our anger. And it's messy, and I still get it wrong all the time, although I'm very good at apologizing. that is one thing that's gotten better over the years. But yeah, I still struggle with it, to be totally honest. But that's okay. It's okay that I still struggle. It's okay that I'm imperfect. That's one of the things self-compassion gives me.
Yeah. One last question before we get into the practice that you're going to lead is about clinicians in the psychotherapy office. How important is it for them to really be trained properly and to develop those skills and those resources, so that they really can guide their clients, their patients, in a helpful way, that they know how to meet resistance, that they know how to meet with whatever walks in the door, because they're teaching and working from that place of loving connected presence or embodied presence.
Yeah, so it's really important for two reasons. Well, the first reason is that I think a therapist needs to embody self-compassion. In other words, not just talk the talk, but actually live it, practice compassion with themselves, in order to be able to embody it in a way that's authentic and model it authentically for clients. For some people, just learning about self-compassion cognitively, it doesn't really go very far. But what we know from the research is often self-compassion is modeled. right? When you see someone, for instance, there's one study that showed if you see someone out loud being self-compassionate, then people start being more self-compassionate themselves. So they kind of model the internal dialogues of others. And so clinicians need to be authentic in it and practice it for themselves to be able to effectively embody and model it for clients. But there's another thing which you know, obviously as a trained mindful self-compassion teacher, it really helps to learn some of the issues that may come up when you're trying to help someone to be self-compassionate. The biggest one, which I'm sure other people have talked about, is backdraft, or Paul Gilbert would call it fears of self-compassion. So for many people, if their whole lives you just closed your heart to deal with your pain, and all of a sudden you start opening your heart with self-compassion, there's a phenomenon called backdraft, which Chris Germer coined. It's like, the fresh air of the love rushes in and the old pain rushes out. And it can be quite explosive. It can manifest either as anger toward oneself, or as you, the therapist, or as shutting down, or as anxiety. It can manifest all sorts of ways. And if you aren't aware that this is normal and to be expected, then you might think you're teaching it wrong, or the client may think that somehow they're doing it wrong, when in fact, we know this is a good sign. Backdraft is a good sign because it means things are starting to open up, but it also means that care needs to be taken to make sure people are grounded, that they aren't overwhelmed, that they open just as much as is safe and then close, temporarily while they need to process, and then they can open back up again. So there is a pedagogy that's been developed for how to teach other people self-compassion. Again, both the mindful self-compassion program, compassion-focused therapy, there's actually a lot of people who've done a lot of important work in this space. And so it really is worth learning about how to do it, because you will hit bumps along the road, and knowing how to work with them is just really helpful.
So Kristin, can you lead us in a guided practice that therapists might find really useful when they're actually working with clients?
Yes, I would love to. There's a practice that we've developed in the Mindful Self-Compassion program called Compassion with Equanimity. And it's great for therapists, or for healthcare professionals, or for parents, anyone really who's in the midst of a difficult interpersonal interaction where they're trying to tend to someone in pain, which is, of course, what therapists do. And it's called Compassion with Equanimity because not only do we need to develop compassion for ourselves and our clients, but also we need to hold the whole caregiving process with equanimity. Equanimity means it's kind of like the serenity prayer. God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. So equanimity is a wisdom practice that understands that we can't control everything, at the same time that it's important that we do what we can to help. And sometimes caregivers forget this. We think that as the paid professionals, I should be able to fix the person who's coming to me, which of course isn't true. So this practice evokes equanimity, and then also uses the breath as a vehicle for compassion, both for ourselves and others. And the reason I'm going to teach it like a meditation, but it's actually, the technique is designed to be used in the moment in an actual therapeutic interaction or some other caregiving interaction. All right. So I'm going to close my eyes because I like to go inward. You don't have to close your eyes while you're doing this. And certainly if you were with like a client, you wouldn't close your eyes while you're doing it. But because we aren't in the therapy room, it's good to close our eyes so we can go inward and imagine that we're in the therapy room. So why don't you go ahead and do that? Imagine that you're working with a client, maybe an actual client in your practice, who, when you see this person, you just find it kind of draining or stressful or overwhelming. Maybe someone who's really struggling. So a client that's challenging to work with. Okay, and so try to just think of one person. You may have several, but just choose one. And imagining this person in your mind's eye, what they look like. All right, maybe what their story is, what they're coming in with. What it feels like to be in their presence. Right. And also getting in touch with some of the stress you may feel, or confusion, or um, other challenging emotions you may feel when you see this client. And so I would like you to just let these words of wisdom drop into your awareness, these words evoking equanimity. Everyone is on their own life journey, right? So as you're thinking about this client, remind yourself, I am not the cause of this person's suffering, nor is it completely within my power to make it go away, even though I wish I could. Moments like these are difficult to bear, and yet I will try to help if I can. Okay, so you're just setting the stage. You'll try to help, but you aren't in control, and everyone's on their own life journey. And so now I would invite you to get in touch with some of the discomfort you feel in your own body when you're with this client. Right. So if you can, just maybe feelings of, again, stress, distress, maybe empathic pain, maybe some confusion or overwhelm or sadness, whatever's coming up for you. And I'd invite you to start noticing your in-breath. Right? You don't have to breathe any differently than you normally do, but just start noticing each in-breath you take. Right? And imagine that as you breathe in, you're breathing in compassion for your own distress, for your own empathic pain, for your own difficult feelings when you work with this person. Right? So you might even imagine that you're filling your body with a gold light when you breathe in. And giving yourself warmth, kindness, remembering that you aren't alone. Okay, and then now I'd imagine that your client again, right, reminding yourself of what your client looks like and their distress, their troubles. And start to focus on the out breath, right? Start to notice breathing out, which you do naturally. And imagine that as you're breathing out, you're filling your client's body with compassion, right? With warmth, with understanding, kindness, care. You might also imagine that you're filling their body with a golden healing light or some sort of glowing light. And now I'd like you to bring both of these together. So imagining that you are in a room with your clients, so imagining both of you. Okay, and as you breathe in compassion for yourself and your own distress. And as you breathe out, breathing out compassion to your client and their distress. So compassion in, compassion out. And sometimes it helps to imagine not so much that you're generating the compassion, but like the compassion is in the air. You're just breathing in the compassion that's already there, breathing in for you and breathing out for the other. So this easy flow, compassion in, compassion out. And also feel free to adjust the ratio, right? Maybe you need to focus a little bit more on for yourself. Maybe you're really getting in touch with some of your empathic distress. Feel free to mainly focus on breathing in for a while. Or if you're really drawn to the suffering of your client, you can focus a little bit more on breathing out. But remember, we have to breathe both in and out to live. Right, but you can adjust the ratio as needed. Right, there's more than enough compassion for me and for the other. Unlimited ocean of compassion. And then once again, letting these words of wisdom just drop into your awareness. Everyone is on their own life journey. I am not the cause of this person's suffering, nor is it completely within my power to make it go away, even though I wish I could. Moments like these are difficult to bear, and yet I will try to help as best I can. Okay, and then letting the practice go. You can open your eyes. Right. And so, of course, in a real therapy session, you wouldn't be closing your eyes. This is just to simulate that. The idea is when you're actually with someone, the equanimity can just be in the background. So for instance, when we taught this to doctors and nurses, they actually put little sticky notes around their environment just to remind them of equanimity. I'm not in control. I can't fix people. That's just kind of the background wisdom. But you can use the breath anytime you feel that sense of, whoa, that was heavy, or I don't know what to say, or whatever it is. You breathe in for yourself and breathe out for the other. No, no one needs to know. But what you do, so I'll tell you something, Lorraine. I do this with my son all the time. I'm not a therapist, but I am a mother of an autistic child. And what I find is if I use the breath, breathing in for me, breathing out for my son, I not only help regulate my emotions, I help regulate my son's because he feels my compassionate presence, and that helps him calm down. And so you can do it anytime.
Kristin, that was really lovely. I really appreciated your guidance there. And I appreciate your comment about co-regulation because that, in essence, is what we're talking about as a parent, as a therapist. How we treat ourselves and care for ourselves has an impact. It's like it spreads the love. So thank you for that.
Absolutely. You're welcome. It's been a pleasure.
Yeah, well, I have one last question for you.
Okay.
As you know, everyone is so stretched right now. And there's just so much intensity, so many challenges people are facing. And I'm wondering if you have any parting encouragement about how people can integrate little moments of self-compassion in addition to what you just guided us through.
Yes. Well, so the beautiful thing about self-compassion is it doesn't take any extra time and it doesn't take any extra work. It does help, for instance, if you like to meditate, it can really help to have a meditation practice that cultivates self-compassion. But our research shows it's actually not necessary, right? So in other words, you're so busy and you're overwhelmed, maybe you don't have time to take even 5 minutes out of your day. Well, in the moment when you're feeling I'm so overwhelmed because I can't even take a break, that's the moment to give yourself compassion, right? So the good news is it doesn't matter how busy you are, how burnt out you are. It doesn't take anything extra to give yourself compassion. In fact, if you start relating to your feelings of overwhelm or burnout or whatever it is with more warmth and kindness, it will actually give you more energy. So if it sounds daunting, like you can't do it, it'll actually make your life easier if you do it. The biggest challenge is simply remembering, because we forget. But it's not rocket science, right? We know how to be warm and say kind words and, to use physical touch. Nothing's really complicated. It's just a matter of building the habit of doing that. And so it's very possible.
Okay, sounds great. It actually
Yeah.
brings us full circle back
Yes.
to the three components of self-compassion. You have to be aware that the suffering
Yes.
is present,
Yes.
and you have to meet it with kindness
Yes.
to the best of your ability in that moment. And most, maybe not most importantly, but it's also very important to remember that we're not alone.
Exactly.
Yeah, yeah,
Exactly. And that's why forums like this are so useful as well, when we remember that we aren't alone and we're all in this together.
yeah.
You could actually call it no self-compassion, because when you give yourself compassion, you're actually reducing that sense of self and separation from others, which is one of the reasons it's so powerful.
Right. Kristin, this has been such a joy for me. Thank you so much for joining us. And I will carry those words of wisdom in my heart, in my head, my body forever. Thank
Thank
you.
you, Lorraine. It's been lovely.
Bye-bye.